Okay, welcome. It took a bit took a bit longer than well, actually it took as long as we expected because we're having technical issues. But okay, welcome to our Facebook Live for Corset Abdominoplasty. My name is Dr. Moradi. I'm here to answer your questions. So fire away. While we're waiting, I'm just going to go through some questions that have been emailed previously. And we're talking about corset tummy tucks. And what exactly is a corset tummy tuck? So I guess we can go back. Let me get some questions. Anyway, can't find any questions. So I guess there's different types of tummy tucks. Starting from the simple, you got a mini tummy tuck. And what does a mini tummy tuck mean? Well, a mini tummy tuck doesn't mean it's a mini incision. It means you still have your incision down here, usually from hip to hip. But with a mini, if that's the belly button there, you're not removing the belly button. You're just pulling it down. Let me find out some more questions, and I think we're going to go one. We're all catching up now. We've got a couple of people online. So we'll wait for a few more people, and then we'll go on, so I don't have to keep repeating questions. Okay, good. We're catching up. 5 people. I think everyone's catching up to my my slow uptake of technology. So, far away, let me. Okay, so where were we? We're talking about tummy tucks. So there's different types of tummy tucks. You've got the mini tummy tuck, which is essentially the same incision as a standard tummy tuck, but you don't need to move the belly button. And that's very rarely used. It's only if you've got any laxity in the lower abdomen and you want to avoid creating a new belly button. Then you've got the standard tummy tuck, which is the incision from, hip bone to hip bone, and then you're lifting up the skin envelope, keeping the belly button on its stalk, pulling everything down and making a new belly button. And the goal of the tummy tuck is to repair any muscle tightening, muscle looseness and separation, the fascia around it. You're also trying to remove any excess skin. And lastly, you're going to try to liposuck any fat or remove any fat, usually in the love handle in the upper abdomen region. Then you can extend that to a 360 tummy tuck, which is essentially a similar thing, or some people call it a lower body lift or a belt lipectomy, and you're using that same excision but going around in the crease line all the way around the back. And that's really good at getting rid of any love handle fat and skin, as well as any loose skin around the back. Then it comes to a fleur-de-lis tummy tuck. Fleur-de-lis tummy tuck is when you make the incision down here and across here. That's really good if you've got any laxity here and you're tightening the skin in that vector. And then the next progression on that is a corset tummy tuck. Now, why I like the corset tummy tuck, whilst it gives you the biggest scar burden, it also is the best way to really tighten the abdominal skin. So what's involved is you're making the incision down here to cut the skin that way. You're doing the lower abdominal skin. You're also doing an incision under the breast crease and lifting the skin up that way. And I like to add an extended component to it. And by that I mean you do all that, but then you extend the lower incision all the way around the back. So you're removing the 360 belt incision, but you're also removing skin in the central abdomen region, and also you're removing any excess in that. So you're pulling this up this way, that way, and this way. So it really is the best way to tighten. And on my Instagram page in the highlights, I've got some photos of patients that have had the corset in the past and some of the results you can get from it. So fire some questions. I'm here to answer them. I'm trying to find some of the old questions that were asked, which I can't do. No, not at the moment. Okay, what more can I talk about? Now, with regards to, does Medicare cover abdominoplasty or does it cover corsets? The rules for Medicare, therefore, health insurance are pretty straightforward. In New South Wales anyway, you can't get any body contouring in the public health system, so it all has to be done through the private. Now, if you have private health insurance, as long as you qualify with a number of things, okay? So you need to have lost 5 BMI points. You need to have... hi Lisa, I'll answer that in a second. You need to have lost 5 BMI points, you need to have had stable weight, and you need to have shown that you have some skin excoriation or skin irritation when your skin folds fall on each other. So if you qualify in those, then you can use your health fund. Therefore, you can qualify for Medicare. Therefore, you can qualify to use your health fund. And what that entitles you to, obviously, is a little bit of a rebate. Most surgeons have a gap on top of that, but all the hospital fees are covered, which for usually 5-day hospital stays, is a fair bit of money. So I think, Lisa, you've asked how long's recovery. I guess it comes down to what type of procedure you've had. So if you've had a mini tummy tuck, usually you can go home the next day. A standard tummy tuck, I like to keep patients in hospital for 2 days. Corset, I try to plan to have patients in hospital for about 4 to 6 days, depending on how they're coping and what their social circumstances at home. So that's hospital recovery. Now, in terms of recovery, when you're back to normal, generally I say to patients, plan to take 2 to 4 weeks off work. Just because of the tightness that you have, you're not going to want to walk around too much. The position of comfort is usually sitting down. Why sitting down? Because your hips are flexed. When you stand up, you're stretching everything, and then you're stretching all the core and stretching all the tight skin closure. So generally sitting is good. In terms of sleep, usually you're sleeping jackknifed with the bed at like 45 degrees. You got pillows underneath your back and pillows underneath your knees to take the pressure off the abdominal closure. Is it easy to revise a corset? I had a fleur-de-lis abdominoplasty and had 8 kilos removed in January, but still have lots of skin above the fleur-de-lis. Yeah, look, in fact, it's easier to convert or do a revision on a corset, because when you've got a normal tummy tuck, the belly button kind of restricts how much you can take. But because we've done the corset abdominoplasty, if you've already got the fleur-de-lis and your belly button's here, we can then just revise the fleur-de-lis or go around here to take more tissue out. Then I would, compared to a fleur-de-lis, I would add skin resection here, and if need be, go around. Fleur-de-lis usually stops at the hips. I usually go around, because whilst people have a flat tummy, the 2 bits that they hate is when they sit down and you get skin and fat there, and also the love handle. So that's why the corset's good, because you really cut that out, and remove that as well. So that's why I like the fleur-de-lis, the corset. Difference between a corset and abdominoplasty. Yeah, I guess. Let me do this. There we go. It's a little bit better. So abdominoplasty is just removing skin in the lower abdomen. So you're just taking out lower abdominal skin, okay? Whereas a corset is you're removing the lower abdominal skin. You're removing that excess in that plane. You're also removing skin here all the way just to the crease. And usually when people combine it with a breast procedure, you're using that breast incision from the breast reduction anyway, and you're lifting up that tissue. You get that lower abdominal tissue, and you stitch it to one of the ribs to really hold that scar high. And then generally a corset stops at the hip, but I always go around the back now, calling it an extended corset to add the 360, because as I said before, the bits that people don't like are there, the excess skin there, and the love handle area. Hope that makes sense. I've got, oh, geez. Okay. Is it just for women post babies? No, not at all. I think corset is pretty much for anybody that's lost weight. And generally it's better for patients after massive weight loss surgery, such as bariatric surgery, gastric sleeve surgery, or if you've lost weight through diet and exercise. So generally it's patients that have lost 20, 30, 40, 50, 60 kilos that it works best for, because they're the patients with the most skin laxity. I've lost 72 kilos, well done, and I've lost, have lots of loose skin and so only belly. I'm really uncertain what I should be asking a consultant. Yeah, okay, so I think when you've lost 72 kilos, which is an amazing effort, I would, generally you kind of need a corset, because if you've lost 72 kilos, you're going to have a lot of skin excess in a lot of different vectors. And a standard tummy tuck, whilst it's good at just removing the lower abdominal skin, as I've said before, you do that and then you've got excess here. So the only way really to get rid of that excess is to make that incision. So if my shirt was my excess skin, like you can pull it down like that, but you can also pull it down like that and do that, and that would be the best way to tighten it. So what you'd ask your plastic surgeon, you ask him or her which technique they would recommend depending on where the laxity is. Recovery, is it similar to tummy tuck? No, it's a little bit more than a tummy tuck, because tummy tuck you're tightening the tissue muscle that way, the skin that way, whereas a corset you're doing all those, but you're also adding that component and around the back, so it's a little bit more extensive for recovery. How does Medicare item number work for this? So I kind of explained it before, but for the people that missed out, the Medicare item number for a corset is 30179. And you have to, if you just Google it in the Medicare laws through the MBS website, it tells you the criteria you meet, which are, if you've lost 72 kilos, you qualify easily. You need to lose 5 BMI points. You need to have excess skin that interferes with daily activity and has skin excoriation, skin, sweating and endangered skin, and you need to have stable weight. Is there liposuction during the procedure as well? Because I have thought it would be longer recovery. Generally, when I do a corset, I do very minimal liposuction. The reason being is most of the fat you're cutting out. You're cutting out all the excess, and then the skin and fat that remain, you really don't want to undermine that tissue or liposuck it, because what that does is it can damage the blood supply to the area. Okay, so generally in tummy tucks, when we liposuck around here, it's okay because we're not cutting it out. But don't forget, in a corset, extended corset, all this goes anyway, and all that goes. So there's not that much fat left. And what fat's left you need, because you need it because it harbors the blood supply, and you need a healed wound. I've had a tummy tuck 10 years ago, and I've lost and put on weight since then, and now I've lost more weight. I have scars from a hysterectomy and other surgery. Just wondering if it's possible, of course. Yeah, look, absolutely it's possible, because you've already got the scar burden, so we're using similar incisions for the lower tummy tuck. The only issue is, and a lot of patients don't mind, is that you have to accept that you're going to have that vertical scar. So you're going to add an extra scar, but you generally cut out the old tummy tuck scar, and you also cut out the hysterectomy scar. Okay, yeah. I got a question. Does a corset help lift your butt if it's gone flat due to weight loss? When you go around and do the 360, yes, it does, because don't forget, you're still doing that lower body lift component. Now, if it's really, really deflated, then because you've got that excess fat, you can either use the fat from the back, liposuck and inject it into the fat, one option, or the corset that you do when you go around the back, you can get the fat folded in on itself, removing the skin, and use that as an auto augmentation for the buttock, because you do have excess of it. So yes, you can do that. Do most plastic surgeons do it? I've never heard of it, and and I wasn't offered it? That's a good question. I'm not quite sure. I mean, they should, if they're offering body contouring surgery, then I think they should be offering corset, because you need to be able to offer everything to your patient, because if you've only got a hammer, everything starts looking like a nail. So if you're only doing one type of operation for body contouring, you're kind of missing the boat, because as I said before, the thing I found with patients is why tummy tucks and that are limiting is it's tight down the bottom, but it has that bulge at the top. Nobody wants the bulge, but particularly when they're wearing dresses, they don't like the bulge, particularly when they're sitting down, they just don't want to have that bulge. So you want to be able to tailor the operation to what the patient needs. Now, not everybody needs a corset, but once you've had massive weight loss and you have excess skin up here, the corset's way better. What about scar tissue, multiple surgeries? Can you get rid of that, or does it make it? Well, yeah, you're removing excess. Well, you're removing the old scar, but you're creating a new scar. So there's always going to be a scar burden and an incision burden. So, yeah, regrettably, we can't do this without incisions and without scarring. Okay, I got a good question. Through pure exercise and diet, Gym Junkie, well done. I've lost 42 kilos in 2.5 years. That's amazing. Well done. 2.4 centimeter abdo gap on ultrasound. Had a consult and he said I could do normally abdominoplasty or just small skin wedge, take out lower pole, and do that and a breast lift as day surgery. I do have a lot of fat. I'm on sick. I just can't get rid of my blood isn't brilliant. Okay, yeah. So I guess if you lost 43 kilos, you're now down to 60 and you go to the gym, you kind of have to assess where the skin excess is. So the 2.4 centimeters abdo gap isn't too bad. I've got a post that I'm going to post pretty soon on my Instagram page of like the muscle closure, what's involved in the muscle closure. Now, if you're going to do a normal tummy tuck, then I think that's perfectly fine, where you lift the skin up all the way, tighten the muscle all the way down, and then reposition the belly button and cut out the skin. So your plastic surgeon, he or she seems like you only have loose skin in the lower abdomen, so I think a normal abdominoplasty is fine. And that will get rid of that, low wrinkly skin on the lower tummy. Perfect for that. I think the corset is used more if you've got lots of loose skin in the upper abdomen and you've got excess skin in the vertical and horizontal vector. So if you've got vertical excess, you do a horizontal excision. If you've got horizontal excess, you do vertical excision. But I think what your surgeon has said sounds pretty sound. What is scar revision surgery and what does it involve? So scar revision is revising a scar. I know that sounds pretty basic. But in terms of the logistics, you can only use a scar revision number if you've had an operation that had an MBS number previously. So you can't do a breast augmentation and then get a scar revision of it because the first operation was cosmetic. You can't have a scar revision of a tummy tuck if the first tummy tuck didn't qualify for Medicare either. So can you do a scar revision of a corset? Yes, because the corset, generally speaking, is a Medicare itemized number. So any revision of the scars, which if they're stretched or if you've got a bit of keloid or hypertrophic scars or malposition of the scars, you can do the scar revision to correct those. And you can use your Medicare and MBS number for that. I lost 132 kilos. That's epic. Well done. And the bulge is that's exactly right. That's where we want to target. My Facebook page is go to my Instagram page is Dr. Moradi.official. So Dr. DRMORADI.official. And then if you go to the highlights section of the Instagram page, you'll see a section of highlights with all the corset photos that I've published. And hopefully that will help. And there's also patient photos who have sent in who are kind enough to share their images and their journey who have sent photos in. So is it any different to a 360 body lift? The classic description of the corset was the incision where you make the cut here to remove that, make that vertical cut, and make the incision from here to here. Now, the 360 is that lower belt lipectomy. So what I've pretty much do in all my corsets now is I add the 360 to it. So I go do the 360 down the bottom, do that and do that. And in some cases, I continue that, like the crease incision, and extend it around to the back and do a bra strap excision as well. So that's like throwing everything at it, because you've got excess around here as well. Patients don't like that excess. So if you can continue that incision where you usually stop that here, go all the way around the back, and connect it to the other side where the bra strap goes, that also gets rid of the bra strap excess. How long will till skin won't rebound anymore after losing weight? No. How long will the skin won't rebound after? I guess with skin is like, it's got elastic properties, and when you see stretch marks, that's just the dermis, the elastic component of skin that's failed, and it loses that elastic quality. So if you're going to do any body contouring surgery, you have to let the skin just relax to its final state. Generally, we say you want to be at a stable body weight for 3 months before you consider doing any body contouring surgery. Next question. Very keen for body. Would you say what? Yeah. Look, thanks for the question. Yeah, the auto augmentation is quite popular because you've got the fat there. You're just folding it underneath. And yeah, we have interstate patients all the time. The hospital stay, particularly for interstate patients, I want to keep you in hospital for a week to make sure you're ready to go. Like local patients, I'm happy to discharge a bit sooner because they live local. If there's any issues as an outpatient, they come and see me. But yeah, we have a lot of interstate patients for this particular operation. Okay, yeah, we're Facebook. Yeah, I don't really post much on Facebook, but the Instagram page, thanks for that. Now, there was another question I just missed out on before. I get a return to exercise. I think a return to exercise, like with most things, comes down to how you feel. And like if you've been a patient of mine, I use this analogy. If you twist your ankle, you're not going to go for a run. Okay, your body tells you to limp, walk, jog, run. Teaches you a new cascade. Okay, so when you've had any operation, you're not going to quickly go do 50 burpees on your first gym session, nor are you going to lift anything heavy. So what are you going to do your first time back at work, or first time back taking care of kids, or first time back at the gym? You're going to start slowly. You're going to do something like, now with a lot of patients that have kids and young kids and have multiple kids, I say to them, remember when you were pregnant in your 3rd trimester with one of your kids, and then you had a 1, 2 or 3 year old, okay? You're not suddenly going to lift up that child. What do? You sit down, put the child on your laps, and you lift with your legs so you don't use your core, okay? Similar to sleep. When you're in your 3rd trimester, nobody sleeps on their back. Everybody gets into a position that's comfortable for them. So usually with pillows propped up. So if you've ever been pregnant and I haven't, but I've had my wife who's had 3 children, and you're in the 3rd trimester, you know that you just get into the right position because you trust your body, and you get into the position that's comfortable. Here we go. No, all good, Crystal. You may have said this, tell me about recovery, how long you'll be in hospital. Okay, so the hospitals I operate at for this sort of surgery is St Luke's Hospital in East Sydney, private hospital. They're all based in the eastern suburbs of Sydney. Our rooms are based in the eastern suburbs of Sydney. The recovery for a corset, if you're out of town, I like to keep you in hospital for about a week. If you've got health insurance, obviously they'll cover the hospital stay, so that's great. Local patients, I've had patients that have had a corset that go home after 3 days because they're ambulant, the drains are out, and they're kind of ready to go and they're happy to go home. I tell them plan for about 4 weeks off work, depending on what they do for work. If you're doing a desk job, you can go back earlier because sitting is the most comfortable position because your hips are all flexed, okay? It's standing all the time that stretches everything. So if you're on your feet, if you're a physiotherapist, if you're a nurse, if you're a hairdresser, you're always on your feet, you want to, take a bit more time off. But if you're in a desk job or can work from home and you can sit, then I would sit. Is it normal for breasts to sag after lifting implant? I'm 6 months post-op and only had moderate profile 220s and have already sagged back to pre-op state. Just not sure if it's normal. Yeah, look, thanks, Colleen, for that question. I think that's a really common problem. And so for lift and implant patients, and you haven't really had big implants, so it's unlucky that it's happened again. Back to what I said about elasticity. By nature, if you need a lift, you've lost some of that elasticity. So your surgeon would have made it as tight as practical or possible to keep it up. The implant stays where it does, but it's just the breast that's fallen off it. So I say to all my lift and implant patients, and I like to do one-stage lift and implants, is that you have to be prepared for a revision just to tighten it. So if you were my patient and it's dropped, then now I'd have that second bite of the cherry to now tighten it. Bearing in mind, when you're putting an implant in, you're trying to make the breast bigger. When you're doing lift, you're trying to make it smaller. So you're doing two contradicting and opposite procedures. So what I would do, now that the implant's there and stretched everything, now your surgeon can go back, he or she can now do the lift as tight as they can, knowing that they don't have to worry about making the breast bigger with the implant. So I think having another bite of the cherry is a good thing. How realistically before you could get back into the gym and when you do hardcore exercise? I think it depends what you want to do at the gym, right? So let's say we're doing breast augmentation. I say to patients that, the second week, go to the gym, do legs, do air squats, lunges, a stationary bike, not a problem. But when you're doing abdominal work, it's really hard to get back into the gym to isolate the body because you can't isolate the upper body or lower body. So generally speaking, I'd say 6 weeks before you're back into the gym and hardcore. Yeah, I'd say about 6 to 8 weeks. Do you usually charge for the second lift and implant procedure? My patients, no. I don't charge for the second lift. That's the discussion we have preoperatively. What I say to patients, I've got a couple of options. I have 2 types of warranties a patient can take out. One warranty is they don't pay anything. And then any revision, for whatever reason, even if they want to go bigger or smaller with implants, I don't charge my fee, but I can't control the implant costs, the hospital costs, or the anaesthetist costs. So the patient is liable to pay for those, but they don't pay my fee. Then there's another warranty that we charge where a patient can buy their warranty, and then we cover the revision costs, such as the hospital fee and the anaesthetist fee. Not the new implant if you want to go bigger or smaller, because that's a decision change. But I think most surgeons that I know, if a patient, if you've had a lift and implant and just need another lift, generally would do the same, I think. Got that little bit of hair that's been annoying me. There you go. How long after stopping breastfeeding until I have a definite lift and implant? I think it's best to stop breastfeeding for about 6 months, so everything is stable, because what you don't want to do is hit a moving target. Because if your breasts are yo-yoing and you're going to get to a final size, you don't want to do your definitive operation too early. So at least 6 months without breastfeeding. Do you only do body procedures? Do you have a recommendation for a person that does good noses? I love doing rhinoplasties. It's one of my more popular operations. Do I know? Yeah, there's lots of amazing plastic surgeons and ENT surgeons that do good rhinoplasty surgery. People can message me and I can tell you who, because I don't want to cause any grief by naming names on this. But I generally do the rhinoplasties with combined operations with breasts and tummy at times, and if they need any functional work, for me, I do the cosmetic part. I've got an ENT surgeon who does all the sinus work and all the septal work and all the turbinate work to ensure good breathing. Post implants, I was an A cup. Now I'm an E cup. However, I'd like to remove them. Will I need a lift? Yeah. So good question. You think you're an E cup and you want to remove them? Need a lift? Good question. It really depends what the shape of the breasts are. Generally speaking, not necessarily. If your nipples are still in a good position, then fine. But if your nipples are now sitting below the crease or near the crease, then yeah, you'll probably need a lift, because you now have recruited and developed excess skin and breast tissue that needs to be reduced. But if any doubt, you do the simple thing. Take the implants out, see how they recover. If you're happy, then you're happy. You avoided the lift. But if you need a lift, then you can do that as a second procedure. Here we go. Can you explain what compression you'd use for corset and how long for? Is it a stage 1 or stage 2 garment, whatever that means? Yeah, a good question. I don't know what stage 1 or stage 2 garment is. I just use a standard abdominal binder. The problem with all the binders is they always dig in, because you've got the breast and they dig in. So very quickly afterwards, I try to get them when they go home to get on Spanx and wear the Spanx that pull up. Patients find that's always the most comfortable, because it's just the most comfortable one. But the garments can dig in, they can fold. I generally try not to go too tight with them, because I don't want to restrict the blood supply to the abdomen. But also I don't want to restrict the venous pressure to the legs, which can increase the risk of DVT. Do I do surgeries in Brisbane? No, I don't, unfortunately. I go to Port Macquarie, which is kind of a third of the way up to Brisbane. But Brisbane's got some fantastic surgeons, and so does the Gold Coast. So, Rebecca, you can't go wrong up there. We're blessed with good surgeons across the, definitely Eastern Seaboard, but also across Australia. Because of our training program, we've got like the most extensive training program in the world. Having trained in Sweden, Belgium, and then the UK, I've seen our training, and it's something to be proud of. How long does the procedure take? Corset? Yeah, good question. A standard corset, I think, takes about 3 hours, but an extended corset where you have to go around the back takes about 4 to 5 hours, because we have to turn the patient and extra suturing. And then if extended with the bra strap, it definitely takes about 5 hours. I'm lucky that my co-surgeon is equally as good as myself, so it's always a little bit quicker for me than most others, because others might have like a registrar or a trainee doctor, whereas Dr. Garrity is fantastic, and he's like having two of me, so we can generally do it a little bit quicker than most, because I've got that extra pair of hands. Would I do a corset by myself? Never. It will take too long, because it'll be too much suturing. It could take 7-8 hours, so you definitely need another surgeon for safety for the patient. I've lost 60 kilos due to gastric bypass. Well done, Rose. What sort of procedure would you recommend to remove and lift for stomach, breast, and legs? Okay, so I would do the breast and the stomach at one time. Why? Because you're in the same vicinity, and if you've lost 60 kilos, there's a very good chance that a corset's the best for you, because you'll have that skin redundancy. And I've said it before, I don't know if you were here before, Rose, but why I like the corset, because when you do a tummy tuck, it's flat, it's good for the lower abdomen, okay? It doesn't do much for that bit. And patients that have lost that 60 kilos, that's the bit that really gives them the shits, right? So I don't want to do a tummy tuck and then you've got this little bulge, and then you're like, well, what was the use of that? When I sit down at work, you can see it. So that's why I like to do the corset. And you do the corset and the breast lift at the same time, because you're using similar incisions. Because when you're doing a lift, you're making that incision. In the corset, we need that incision to do that aspect of it. And then you'd stage it and do the legs at a second sitting. Now, the reason you do that is because it's a big operation already. You don't want to add extra time. But equally as important, Medicare changed the rules about 18 months ago, where if you want to use a Medicare number, therefore your health fund, you can't combine the tummy with another body part that's not the breast. So you can do a breast lift or reduction with the tummy, no worries, but you can't do an arm lift or a thigh lift combined with a tummy. And the logic behind it is they just want patient safety. They don't want patients under anaesthetic for, greater than 8 hours, unless they have to be. In the major teaching hospitals, we do 12-hour operations, but they're generally cancer operations and patients really have no other option. But when you're doing elective discretionary surgery, it's better to stage it. Oh my God, Spanx, I love it. Yeah, I listened to a podcast from the lady that started Spanx, and it was an amazing story how she started Spanx. And when it first started, she went to every retail store in America, and she was her own rep. She didn't have any reps. And she sent a sample to Oprah Winfrey, and Oprah put it on the show, and then in the first week she had 30,000 orders, and she was the only person working. So it's pretty cool. She's a pretty fierce woman. It was on a podcast by Lewis Howes, if you ever get a chance, and this story behind the lady that created Spanx. Cool. So that's a little side story about Spanx. I had a breast lift and reduction about 10 years ago, and sometimes my scar on one side really hurts and it feels like something is pulling, something I should be looked at. Oh, look, yeah, it's a bit strange that it's 10 years. People that get hypertrophic scars can get pain and itchiness, so cortisone can help with that. At 10 years, you really shouldn't have pain. Do I think it's anything sinister? Unlikely. If it is, if you can feel a lump in the breast, you should always, get an ultrasound to make sure there's no underlying mass. But the scar itself, if it is a bit tender, cortisone helps with that. Best recommendations then in Brisbane or Gold Coast? Can you email me and then I'll send it to you? So I think on the Gold Coast, you got some very good surgeons. Terence Camp, Craig Late, Luke Stradwick. Just off the top of my head, they're very good. Up in Brisbane, you got the Thiel brothers, which are fantastic, and you got Valley Plastic Surgery as well. They've got a great reputation as well. So all those clinics are pretty damn good for this sort of work. But feel free to email me, and then I can arrange introductions. I do reconstruction after mastectomy. Yeah, that's pretty much that and head and neck reconstruction is my bread and butter at the Women's Hospital in Sydney. So I work in the public hospital, the Royal Hospital for Women and Prince of Wales campus in Randwick. And my lists on a fortnightly on a Monday are pretty much all breast reconstruction after mastectomy. And then at the Women's Hospital, I have a list every 6 weeks, and it's all a reconstruction after mastectomy. So, and most of my private patients I take to the public because the care at those two hospitals is pretty amazing. Can you give me a rough cost for Corset? It comes down to whether you have health insurance. So if you could message or insta message me, and I'll introduce you to Catherine, our practice manager. She'll be able to help out with that. But as a rough guide with everything, you're looking at about 20 to 25,000. Why is plastic surgery so much more expensive in Australia? It's half the price in the States. A couple of reasons why it's probably more expensive is our hospital fees are more expensive than anywhere in the world. So to hire theatres, it costs about $2,000 an hour. And if you're doing a 5-hour operation, that's $10,000 that goes straight to the hospital fees. We don't have the ability to start. It's harder for us to start our own day surgeries and day hospitals because we're way more restricted in our use. And the other reality that you have to face is, I guess, there's more competition in America. So there is a greater demand, but there's a greater surgical load. There's more plastic surgeons, so therefore there's more competition. So I think that's a fact that you need to take into account. The competition is there's more plastic surgeons per population in America, I imagine. Do I do any public hospital work? Yeah, as I mentioned before, I work at the Women's Hospital and Prince of Wales. I've got a fortnightly list there where I do pretty much head and neck and breast reconstruction. So head and neck is someone loses a jaw, tongue, nose, make them a new nose, tongue, and jaw. Breast is obviously you make a new breast. Oh yeah, you saw the podcast? Cool, legend. Fat transfer to breast due to worry about breast implant, and surgeons say unreliable. Look, here's the thing with fat transfer is if you put 200 grams of implant in, 200 grams of augmentation will occur. Now, fat grafting is like laying seeds. So if you've got seeds and you put too many seeds, some of it's not going to take. Now, not taking is not a problem if the body dissolves it. If you put too much fat in one sitting, and the fat that doesn't survive turns into lumps of fat necrosis, then it causes pain. It can be a problem. Now, I had this discussion actually with Dr. Tavakoli recently, where people are claiming that they can, they know exactly how much fat survives. I think it's all BS. There's no way anybody knows that how reliable, how much fat can survive, because the only way that you can do it is get a 3D image of a breast before surgery, measure how much fat you put in, do a 3D image after. But the problem is you have so much swelling after surgery. So then you do another 3D image 6 months later, and you're going to have a discrepancy in all those measurements, because as soon as you put the fat in, you're going to get swelling. So you don't know whether the volume is the fat or the swelling or what have you. As a rough guide, we say 50%. Now, if I put 50 grams of fat just in the cleavage pain, I'm pretty confident that most of that 50 grams is going to take, because we're putting a low burden of fat. But if I try to augment a breast with 400 grams, the less percentage of that will take, because you're asking too much of the breast tissue to make that fat survive. So I think fat is fantastic. I use it a lot, but I use it as in a hybrid situation with an implant, so that you use slightly smaller implant, put a little bit of fat in, because more of that fat takes, because you're putting a less proportion of it. Okay, so back to the seed analogy. If you put fat, if you've got lots of nice healthy breast and you put fat, most of that would survive. But if you've got no breast tissue, then the land that you're putting the soil that you're putting the fat isn't going to take it, because you don't have enough vascularity for it. How much is your consultation? Was your consultation $300? Rough waiting time, I'm not sure. So Catherine, my practice manager, will help with that. You can't ask a surgeon, because we'll just say, yeah, come in tomorrow, without the repercussions of ruining everyone else's day. Are you ever home? No, I get home. Besides tonight, I try to get home at 5 o'clock most nights, and I work a 4-day week because I've got other things to do. Is it any cheaper in the public? Look, the public sector doesn't allow body contouring. Some hospitals, I've heard, have got exemptions. My hospital, Prince of Wales, the New South Wales health authorities brought in rules that you can't have tummy tucks, can't have tummy tucks, body contouring in the public hospital, breast reductions on severe cases on a case-by-case basis. And you have to be in area for that hospital. So the only tummy tuck that I've ever done in a public hospital was when a lady's apron tummy was touching her ankle, believe it or not. And then we made a case to the hospital executives that this is not a cosmetic procedure, nor is it body contouring. It's a safety procedure. And then we removed that apron, and it weighed 32 kilos, which was pretty amazing. I'm 3 months post-op from tummy tuck. The top part. Yeah. So Vicky, you've said exactly. The bit that you don't like is that top part of the tummy, because the front, the bottom is flat, and the top, that to me is what people complain about the most, more than the bottom, because we can always make the bottom tight. It's that top, and that's why you can't tighten up here from down the bottom. So that's why the corset is pretty good for that. But if you're happy to have the scar, you can still have the corset now. Can you tell why you shouldn't go overseas? Pros and cons. Go overseas for holiday, or everyone should go overseas for holiday. I guess right now coronavirus is a different issue, but I'm guessing you're asking about go overseas for surgery. Look, I think it's naive, arrogant, and ignorant of Australian surgeons to say that surgeons in Thailand, China, Any of the subcontinental countries were less trained than us, or not as good as us. I think that's wrong. I think they'll have just as good a surgeons as we will. I'm sure their facilities are going to be just as good as ours. The only thing that I see as a problem with it, is that you just don't have the follow-up. So if things don't go well, you don't have access to your surgeon to call him or her, to send photos, to be able to quickly go see them and discuss your case with them. Does amazing work happen? Absolutely. I'm sure people in Thailand have done better jobs than we have done in Sydney and vice versa. The only thing is that you just don't know, and you don't have the access to them afterwards. So, the pros and cons, everyone should kind of know their own pros and cons, but I don't believe in the propaganda that a lot of Australian surgeons and American surgeons for their overseas colleagues, or the British surgeons and their Polish, I think that they go to Poland or Spain for the surgery. A lot of it is turf war, but I think as long as the surgeon is trained and you've seen his or her work, and you know someone that's gone there, and you trust them, then by all means, I'm sure they're very good. But it's just the post-op care that can be not as good as ours, as someone local, not as ours. Lost 45 kilos and she's only 17. Is she too young, but she hasn't had children? Look, good question. You can have children afterwards, after a body contouring. That's not an issue. 17 and 45 kilos. The rules in Australia are cosmetic surgery and, between 16 and underage needs 3-month cooling off period, as well as seeing a psychologist. However, this is not a cosmetic procedure because there's a Medicare item number to it. So I don't think those rules apply. This is mainly for rhinoplasties or breast augmentations. But when there is a Medicare number for it, which there is for this, then it's not an issue. I would not operate on 17 at the moment. I'd say at least get to 18, 19, just so that we know that the weight is stable. Do you do anything for cellulite? There's not much for cellulite, and what you don't want to do is make cellulite worse by doing liposuction. So sometimes when you do lipo with cellulite, it can make it worse. So unfortunately, not much at the moment. Can you show us where the scars will be if having a corset? So if you go on my Instagram page, there's a highlight thing about all corsets, but let's go through it again. The corset is going to be the midline scar here, scar across here, and scar across there. So that does that vector, that does that vector, that does vector. So that's the standard corset. I pretty much on all of them add a 360 where I go around the back and do the 360. So it'd be the belt lipectomy incision along with that and across with that. And I think that flattens everything out the best. Fleur-de-lis is what I got. I love it. My tummy looks hot. Yeah, well done. Awesome. Well done, Kimmy. Yeah, so fleur-de-lis is pretty much the same as a corset. The only difference is that the corset also adds that component to it. So fleur-de-lis is fantastic. Back to at the start, I talked about the different types of abdominoplasties, from mini to standard to extended to belt to fleur-de-lis to corset. So corset's just part of the continuum of the abdominoplasty, and you just tighten that a bit more. And why I like what I call the extended corset, it's a made up name, is that I do the corset but add the 360. Do you get a big scar after tummy tuck? Yeah, define big. Big as in, yes, they're long, but hopefully not big as in thick. So yeah, the more excess skin, the bigger the scar burden, and most surgeons have a scar protocol afterwards. Why do hemoglobins drop so dramatically in plastics? That's a really good question. I was just so whilst, and I was talking about to one of my corset patients today, is corset tummy tuck, you don't bleed that much, okay? But post-operatively, a lot of patients have low hemoglobin, and the reason is you're removing about 5 to 8 kilos of skin, and that skin has blood in it, okay? So you're removing that skin, throwing it in the bin, but that blood hasn't had a chance to recirculate back into the vascular system. So whilst you haven't bled, you've lost all that volume because a lot of that blood's in the skin. So that's why. You had surgery overseas, a big mistake. Oh, I'm sorry to hear that, Colleen. Hopefully it's fixable. Can a fleur-de-lis be done after a tummy tuck? I had a tummy tuck 6 months ago. I had a very wobbly tummy. Still not sure if I need revision due to... Yeah, look, I think if you've had a tummy tuck, your surgeon would have taken as much as he or she could have in that lower abdomen. If you're still loose, that's why I like that fleur-de-lis component. For those that don't know, fleur-de-lis is just a vertical component. And why it's called fleur-de-lis, it looks like the fleur-de-lis because you've got like an upside down T. Yeah, you probably do, and you can do it because you just have to add that incision. Kimmy, how does a corset differ from fleur-de-lis? It differs because, as I said before, it's like a continuum. You've got mini tummy tuck, standard tummy tuck, extended cup tummy tuck, belt lipectomy, fleur-de-lis, and then corset. Now, how it differs is fleur-de-lis goes there and there. Corset also adds that. So once you've tightened here, tightened there, you add this component to it on both sides, and that really lifts that up while you're pulling that down and pulling it that way. And then I also add a belt to it. So unlike a fleur-de-lis, then I go around the back as well. So that's how it's different. Okay, my girlfriend had a lower body lift and had to go to ICU after, so it freaks me out. Could have gone to ICU. Okay, so there's a number of reasons you go to ICU afterwards. Thankfully, I haven't had to send anyone to ICU. Is they may have had a bleed and they need some hemodynamic support. More likely than not, they've just gone to ICU for monitoring because they've got better monitoring. And once you've removed all that breast tissue and essentially had a hypovolemic event, you've taken all that blood away, it's really good to be monitored in an ICU or a HDU environment, so you've got nurses and constant monitoring. So I suspect that's why your friend went into ICU. The things that can go wrong in that immediate period mainly are like breathing issues, because you're so tight you can't expand your lungs, so you may get pneumonia and lung collapse. So what could go, you may need a blood transfusion. You don't really get infection in the immediate post-op period, so that wouldn't be the cause. But mainly it's just for monitoring. My recovery was bloody hard with FDL with lifestyle. Yeah, it's just tight. You're tight because you remember you're vicing everything closed that way and that way, so you've got nowhere to move. Everything's been pulled in not only one dimension, in two dimensions. The liposuction is not the painful part, it's just all the tightening. And as I said previously, I do very minimal liposuction when I do the corset because it affects the blood supply, and also I don't want to cause extra bruising and extra fluid loss from it. So it's only minor liposuction, and most of the excess fat I'm cutting out anyway. So all that love handle fat is all going anyway, so I don't need to liposuck it because I'm cutting it out. If that makes sense. Now, what else was I going to talk about? So we talked about recovery, the different types of abdominoplasty, and also actually I think with every body contouring patient I say to them, plan for a revision. Like I almost say you got 100% chance of a revision, because when you're removing you got scars, you got a big scar burden, you may not be happy with one of the scars, one might be a bit raised. After you've done it all, it's super, super tight and it loosens, so then you're like, okay, maybe I need to tighten that some more. So you always need that second bite of the cherry. So I think when you're embarking on body contouring like a corset, I would always plan in your mind for a revision operation. Yeah. They're Theile, Theile, Theile. Yeah. Who else? Yeah, and then the people of Valley are very, very good as well. So yeah. But if you go on the ASAP's or ASP's website, you'll see who's local to you, and just get in touch with them and see. Most patients send me photos and I give them advice before they come in, and I think that's we're a consumer-driven society. I'm a consumer. I buy stuff. I like when people respond to me, so I feel the same. So I'm sure you send your photos to a surgeon, get their advice. You send it to a number of surgeons, and then get the one that kind of fits with your personality and kind of knows what you're talking about. Look at that bit of hair. There you go. What else? Any more questions? What else could I talk about? Yeah, so I guess the scarring, the recovery, what's involved in the operation. If you go on my, as I said, on the highlights page, there's a store. There's all the corset photos, and I truly believe that's the best way to get the flattest tummy is to cut out more skin. So the more skin you cut out, the flatter it's going to be. What I was going to say, ironically, with corsets, whilst it's a lot of incisions, there's less drainage because with a corset you don't undermine any skin. You're just moving the skin around. There's no undermining of skin to maintain the blood supply to the area of skin. So I find that the drains we put in generally come out in day 2 because they're not doing anything, because there's no dead space. So, what time is it? 7:15. So, yeah. So fire away any more questions. I feel like I think I've answered most of them. Just looking through some old questions. Oh, here we go. Here's one coming up. No need to be rude. You're all good. Butted auto with private and his MBS 30171. Good question. Usually when we're doing a corset or a belt lipectomy, we use the number 30179. So a similar number. So if you email me at info@drmoradi.com.au, I'll introduce you to Catherine, our practice manager, and she'll go through all the costing and go through all the numbers with you. But yeah, no need to be rude. It's all good. I will be having kids in the next 2 years, but I've just lost 50 kilos from... okay. Should a breast augmentation be a good option? Now, look, if you're planning to have kids in the next year or 2, I wouldn't get breast augmentation, because the breasts are going to change as soon as you get pregnant, as soon as the milk comes in, as soon as you're breastfeeding. So I wouldn't do it if you're about to breastfeed, if you're about to get pregnant, because there's a chance that you'll need a revision. It's always best to do it, when everything's stable. The question is, I would wait, because everything's going to change afterwards, for better or worse, and you don't want to have to redo it. Here we go. How long will it take before I start to run again after a body lift? I lost 100 kilos. Well done. I have quite a lot to remove. I think with running, I think you're going to have to wait about at least 4 to 6 weeks. And as I said before, you just have to you just trust your body. After you discharge from hospital, absolutely go for walks, okay? Because you want to walk for a number of reasons. 1, to open up your lungs so you don't get lung collapse or atelectasis, where your bottom of your lung collapses. 2, to minimize your chance of DVT. So you're walking anyway, and then you'll slowly teach yourself to go a bit to start running, but you don't want to overdo it. So I would plan for at least 4 to 6 weeks, because there's no rush. like this, Facebook Live. It's so real. Okay, so if there's no more questions, I'll let you guys go. Thanks for listening to me chit-chat about it. If you got any questions, if you go to my Insta page, drmoradi.official, you can message me that way, or email at info@drmoradi.com.au. Even if you send photos, I'll give you some advice on what I would recommend, and then you can go to your local surgeons and see what he or she says. The more information and the more questions you ask pre-surgery, the less regrets you'll have post-surgery. So that's my parting gift. So thank you very much. I'll talk to everyone soon. Thank you.